Welcome everyone to today's webinar. I am Eric Oliver, a writer and reporter with Becker's ASC Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we'll be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Gregory Deacon-Sealis has been a physician assistant in orthopedics since 1999. In May of 2004, Greg opened Boston Outpatient Surgical Suites in Waltham, Massachusetts, an orthopedic and pain management ASC. POSS, as the center is known, has completed over 60,000 surgeries to date and averages over 500 cases per month. Greg also works with Eastern Massachusetts Surgery Center, a multi-specialty ASC in Norwood, Massachusetts since 2012. Greg is the president of the Massachusetts Association of Ambulatory Surgery Centers, a position he has held for over 4 years, following 2 years as vice president. Greg has authored numerous ASC and outpatient surgery-related articles and continues to be active as a physician assistant, still scrubbing in on complex cases each week. We are also pleased to have Jonathan Karnya here with us today. Jonathan is the Director of Customer Operations for Non-Acute Channels for OptiFreight Logistics and is responsible for the strategic development of logistics and freight management services for non-acute healthcare channels such as ASC, lab, and pharmacy. Prior to Cardinal Health's acquisition of FDSI Logistics, Jonathan was responsible for sales and marketing. He led the field operations team and serviced national accounts while continually working on developing innovative solutions to change how logistics and freight are delivered to the healthcare industry. Mr. Karnya is a native to Northeast Ohio and has a bachelor's degree from Ohio University. Prior to FDSI, he served several years as an EMT paramedic for the city of Atlanta, providing him not only experience as a clinical end user, but also in healthcare operations from the ground level. Jonathan, I'll now turn the floor over to you.
Thank you, Eric, and thank you for the introduction. I wanted to thank everyone for joining us today, taking some time out of your busy day at work. And for those of you who are heard, I am calling in from Georgia. So if you're taking a break from the Masters, I appreciate you joining us as well today too. So we are looking forward to our discussion today, revealing hidden savings in your supply chain. I apologize. There's basically two objectives we want to accomplish today. First, we wanted to bring forth a cost reduction area that you may or may not have heard of and maybe taken or evaluated at your facility yet. And then we wanted to take that opportunity and detail the ease of use and how we could ultimately implement it at your surgery centers. And for those of you on the line that are currently using a freight management program, we're also going to touch on how to maximize the value of your freight management provider. But before I begin, as Eric mentioned, I am part of the OptiFreight Logistics team. So I wanted to tell you a little bit about who OptiFreight Logistics is. Our primary objective in the healthcare marketplace is to reduce costs for our clients. We currently are managing over 18 million shipments per year across the entire healthcare network. When we have over 7,000 healthcare vendors enrolled in our freight management program. That's going to be an important number that we're going to come back to later today as you see what value the vendor participation is in freight management programs. As I mentioned, we serve over 21,000 healthcare facilities across the entire country, and over 2,000 of those are surgery centers. So your counterparts across the country are currently using OptiFreight Logistics. We are on contract with all the major national GPOs and quite a few regional and local GPOs as well. So there's easy access for our members to access our program. And collectively, we save over $200 million a year for our clients combined. We have strategic relationships with thousands of suppliers, but we also have relationships with over 25 carriers, which allows us to expand our scope and ultimately manage more freight on behalf of our clients here. So let's talk a little bit about the current surgery center marketplace today. We know it's constantly evolving, and healthcare providers like yourself are expected to do more with less every single day. These changes are forcing our providers to look at their operations and identify methods to reduce costs while continuously driving improved procedure outcomes. And surgery centers, like so many other markets in healthcare, is constantly evolving and never staying consistent. So we're seeing more surgery centers open every day, and it's because the cost of care is much less than the hospital. In addition to these new surgery centers opening, we're also seeing the consolidation of the marketplace. And whether these consolidation is through these the regional groups, which Greg will talk about a little later on this call today, or if they're with the national groups, or even hospitals buying up these surgery centers, we understand that there's more consolidation on the way. We're seeing new procedures being performed at your surgery centers, which is opening up new revenue streams for you that have not previously been there before. Probably one of the most common case studies that most of us have heard of if you went to a business school, or quite frankly anymore, if you open up the internet and read about a business case study, we know that it was a company called Kodak Film that for the longest time had the majority of the market share when it came to photography film. Over time, as the market changed and we went from your standard 35 millimeter to digital, Kodak refused to ultimately evolve with the market, basically overnight had to file for bankruptcy because they were unwilling and unable to change. So we understand the benefit of being agile and adaptable to ultimately control your costs to stay ahead of the marketplace. So the topic we're going to talk about here today is the hidden fees of freight. It's a fun topic to talk about, and again, not one that we always take a look at in detail, but we will today in this next hour or so. So there's basically two ways in which your facility receives product coming at your receiving dock. There's the distributor, and think of that as your Cardinal Health, McKesson, Owens & Minor, and there's ultimately the supplier shipping to you directly. Now, some people are surprised to realize that not all of their product is coming through the distributor. In fact, what we found is that only 40% of your product is coming through that distribution model, which means the other 60% is coming directly from the vendor. Why is that important? Because with the distribution model, the freight cost or the delivery cost of that product is typically included in your master contract. If you have an agreement with McKesson, with Cardinal, ultimately your delivery costs for all those products coming in every morning are going to be included, so you're not going to see that freight cost. We're actually going to take that bucket and set it aside for this conversation. We are not addressing the distribution cost today. What we wanted to focus on is that direct vendor cost that's coming to your, when a vendor or manufacturer ships directly to your facility. The reason being is because you are typically paying for the freight in a method called prepay and add. Most commonly, you're going to see this in form of a freight or a shipping and handling charge directly on your product invoice as a separate line item. That cost is what we want to address today, and that cost is ultimately where you're going to be able to find some hidden savings that you may not have seen before. The value of savings can typically be between 30 to 50% versus what the manufacturer is charging you today. And the reason is because manufacturers, while there's no secret or there's no standard cost plus model that every manufacturer sticks to, on average, most vendors charge greater than list price when they're assessing freight directly to you on the product invoice. What's the reason? And this is probably pretty obvious. It's because they use it as a profit center. This is a time that I typically tell a story because I think it's relatable, where I have a friend, and this goes back a couple of years. In fact, it may date me because I'm going to use an old technology firm. I don't think it's used too commonly today, eBay. But eBay was, for those who aren't familiar, was a site that you could basically sell, post, and sell product, your own stuff laying around the house, reusable stuff, whatever it may be. But the whole idea was you post on the website, you assess, you tell there's either a bid or you sell directly, and then you ship your product directly to whoever was lucky enough to win that bid. And I remember specifically, I had a friend who has no experience in supply chain and quite frankly, little experience in business. And I remember the day he called me and said, hey, Jonathan, I think I figured something out on eBay. I can sell my stuff. I think he was selling some tools out of his garage. I can sell my tools much faster if I don't charge that much for the price of the product. And then when the transaction is about to be completed and I ship this product to whoever ultimately won the bid, I can charge them more for freight than I'm paying, and I can make up the difference, and ultimately that's where I'm making most of my money. And I thought to myself, I said, Al, congratulations. I'm glad that's working out for you, but that concept is not new. The idea of manufacturers and suppliers using freight as a profit center goes back probably since the start of shipping itself, and ultimately when a manufacturer controls the freight cost, they can ultimately control that profit center. So this isn't any new concept. It's when the market and when the consumers, in this case the surgery center, takes control of that freight cost, that it changes the dynamic and ultimately allows you to reap the benefit of managing that freight and saving some money. So when you are ultimately being assessed that freight charge, and you'll notice here on the slide that often in addition to the freight, there's also a shipping and handling charge or a restock charge. Sometimes you can see it, sometimes you can't. That ultimately is a point for us to focus on, because you can help reduce your overall cost if we address those handling fees and ultimately those restock fees that you may or may not be susceptible to paying. There's also a very specific nuance when it comes to shipping as far as how fast the product is getting there, which we're going to touch on a little bit later on today when we go over the best practices. But occasionally next day delivery is not always needed. And that's ultimately how the vendor is set up in your system to ship to your facility. If they're set up to default to an overnight package or to even a second day package, but in reality, you may not need that product for the next 5 to 10 days. You are going to be paying the full cost of the expedited freight when in fact you do not need it to be there that quickly. So all of this comes together, and what we've realized over the 10, 15 years that we've been in this marketplace is that on average, we can save $17 per package that is being shipped directly to you from the vendor to your dock. So what does that mean? So $17 per package, it may seem a little small, but if we take that and multiply it out by all those direct shipments that are coming into your facility, and again, just using the industry standard of 500 or so annual packages that are being shipped directly from the manufacturer, if you take that $17 per package savings, you can see how it quickly adds up to thousands, in this case, $8,500 a year in additional savings. And what's important about that savings is how you achieve it and how we ultimately can implement a program that will not interrupt your product flow and definitely and absolutely not impact your patient outcome. So we're going to talk a little bit about understanding freight management and ultimately how the process works. So before we get into how the freight management process works, let's talk a little bit about what you're currently doing today when you're not using a freight management provider. So we have a little flow chart here that shows it's a pretty simple process. Today, you, your team, your procurement agents, they're ultimately initiating a PO, submitting it through either some form of ERP system, potentially calling the vendor up or emailing the vendor to submit a PO to the vendor to ultimately start that product flow. The carrier, so think FedEx, UPS, is going to pick up that product from the manufacturer and they're going to deliver it to your dock. That's the basic cycle. It's not too complicated to understand what we're talking about here. The nuance of what freight management providing or a freight management program provides is ultimately the back end, and we're going to show this cycle again of when you're going to ultimately use the freight management provider to save money. Your process stays the same. Your PO is still initiated. The carrier still picks up that product from the vendor, ships it to your dock. The only difference is now that freight charge that was previously on the product invoice is now going to be removed. It will be aggregated to a freight invoice at a lower cost and invoiced to you directly, providing you not only savings, but also increased visibility and transparency, and ultimately being able to control your freight costs for the first time. This is probably one of my favorite slides that we can solidify this concept. If there's any question as far as how this program works, this typically is the slide or this concept that bring most people into understanding fully the value of freight management program. So if we take a look on the left, you'll see a standard product invoice. So this is just a sample, but you're basically paying, in this case, the product cost was identified at $693. And then you're going to see that shipping and handling cost, which is itemized here at $50.79. This is in concept when you're not using a freight management program. When you ultimately route this freight through a freight management program, that's $50.79 comes off the product invoice, is discounted by the provider, and invoiced to you directly at $26.20. Again, achieving our average $17 per savings or per package in savings in a freight management program. Again, this is a single transaction, and multiply this over hundreds, if not thousands of transactions at your facility every year. You can hopefully start to see how the value of a freight management program is going to add and accumulate very quickly. So again, going back to the dollar and the value to your facility, how fast and how easily you can achieve this. So one of the best components of using a freight management program is that it's simple. It is not going to interrupt your product flow. There will be no impact to your patient care or patient outcome. And ultimately, the savings are immediate. How it ultimately works is that you identify all the vendors you're currently doing business with, A through Z, think Abbott through Zimmer, and the freight management provider will ultimately coordinate that list or that communication with those vendors to implement them into the program to ensure they utilize a third-party account number correctly. The freight management provider drives this process. This is not an initiative for your team. This is not an effort that has to be on your team or your staff to ultimately drive the volume through the program. That is ultimately what the freight management program provider provides. The cost savings on every package, going back to that $17 per pack, it's immediate. It starts from the first package that comes through the program. So the bottom dollar savings are immediate, and they're very effective when the freight management provider is managing the process. So let's take a look here at some key considerations when you're evaluating a freight management provider. First and foremost, as we talked about, you do not want to change your existing material flow. You don't want there to be any impact on how you're submitting those POs and how you're ultimately receiving the product at the dock. You're going to be using the same vendors. You're going to be using the same vendors you are today. You're just going to be, again, removing that freight charge from the product invoice. So you want to ensure that the freight management provider you're evaluating has the scale and scope and those vendor relationships to drive the greatest value through the program. You're generally going to be using the same freight carrier. Commonly, FedEx, UPS, whoever your freight management provider is using, it's going to be the same national carrier that's going to be making those deliveries to your facility. Scale is arguably one of the most critical components of a freight management provider. You're only going to save money if a vendor is using the third-party program appropriately. So you're going to want to ensure that your provider has those vendor relationships. They have a mechanism in which to implement those vendors in the program to ensure they're shipping appropriately. The more vendors they can access and the more vendors they can communicate with and the more vendors they can implement, that's going to equate to more savings at your facility. And also, you're going to want to ensure whatever process they use to implement those vendors is effective, because the more penetration you have, the quicker you're going to see savings and the greater savings you're going to see overall. Pretty simple concept is that a rapid implementation is going to equate to immediate savings. So we started this conversation talking about the initial cost value of routing freight through a third-party freight management program that can save on average $17 per package. But I also mentioned that arguably, if you're not managing your freight, you may not have visibility, control, or even knowledge of your freight costs. So one of the additional benefits of a freight management provider is the metrics and the reporting that you ultimately will have access to, perhaps for the very first time. So of course, you're going to want to have a savings report. You're going to want to be able to identify and track what type of savings this program has provided. You're also going to want to have reporting that identifies the shipping modes. So we talked briefly about it in the beginning of this discussion about an overnight package versus potentially a second-day package versus a ground package. One of the major components that drives the cost of freight is speed. So for those that aren't aware, if you haven't thought of this way, there's a handful of components that will equate to the cost of shipping. It's going to be the weight, it'll be the distance, and the speed. So if a package is shipped to your facility faster and it's not needed to be there that fast, you're ultimately spending money on freight that you can reduce by shifting modes. when you get into actually evaluating freight and realize that in some cases, depending on where a vendor is shipping from, you can actually utilize a ground level service that will get there the next day or within 2 days at a fraction of the cost. An average priority overnight package is about $32. An average ground package is about $9. So hopefully you can see that even after you get the initial benefit of the freight coming through a program, you can still work with your freight management provider and your vendors to reduce costs even further if you have access to the appropriate reporting. We talked a little bit about this earlier as well, the handling fees. If you're not using a freight management provider, you're arguably not tracking your handling fees as well. Those handling fees add up. In some cases, they are included in the contract with the supplier. In other cases, they're just added to the invoice without your knowledge or without your agrees in the actual contract. And that goes the same with accessorial cost as well. Accessorial in this case is additional cost from the carrier. So think of it on a good example in this discussion would potentially be Saturday delivery or maybe even signature required. If a vendor is initiating the signature required or shipping a package to your location on a Saturday, and perhaps your dock you're receiving is not open, the carrier is going to assess you an accessorial fee for that service. Again, you may not be aware of it if you're not tracking your freight costs. So this is just another area and component that we can identify to help reduce costs even further beyond a carrier discount. And of course, you have the ability to benchmark your costs maybe for the first time. That's both benchmarking against prior to the program. You can also benchmark your cost against similar surgery centers across the region that you may be located, ultimately giving you an understanding of how you measure up and how well you're doing compared to your counterparts in the industry. So as I mentioned, I'm aware that there are some participants on the call today that have already opted to use a freight management provider. In that case, I wanted to review a couple of best practices that you can deploy at your facility to drive even greater value through your program. First, and potentially the highest impact, is something that we refer to as PO comment, but the concept is simple. It's when you place that transaction, when you submit that PO, if you include the freight route language or the routing language in that PO, on every PO that goes to that vendor, we've seen an increase of 40% participation in the program. So I can speak on behalf of OptiFreight. I know we have some very standard language that we can include in the PO, and we can show our clients that ultimately want to use this best practice, and it helps drive additional volume through the program. And again, the greater volume in the program, the greater the savings to our clients. Large freight. So when we refer to large freight, we're talking about freight transactions or shipments that are greater than 150 pounds. Terms like some of you may have heard of LTL or less than truckload, potentially even a full truckload. These shipments are typically less frequent than your small boxes that are coming from FedEx or UPS, but of course there's greater cost to those larger shipments as well. So depending on who your freight management provider is, you hopefully would have access to a large freight program that helps coordinate, set up, and reduce costs on those large freight shipments. We see these a lot with some capital equipment coming into your facilities. Maybe you're doing a renovation, some construction, and you're ultimately going to be assessed the freight costs from a FF&E type vendor. That's typically when we see our clients utilize these large freight transactions. So let's also, what we've talked about so far today is your inbound freight, a vendor shipping directly to your facility. Again, if you want to maximize the value of your program, you could ultimately use the freight management provider for your outbound shipments. Now, the industry standards tells us that most surgery centers, when it comes to their freight cost, about 90% plus is inbound. So we're talking about a much smaller fraction of your actual freight cost, be it 5, 10%. But if you have access to an outbound shipping program or a portal, this will help drive additional value and savings through your program. And again, I can't be redundant with this enough. reminding your suppliers to use the freight management program. Now, as effective as the freight management provider is in coordinating the efforts to get the vendor to ship through the program in the first place, it does not hurt. It only provides benefit if we are constantly reminding the vendor of that third-party account number and of that freight route guide at time of transaction. I know some of our clients in the surgery center space are placing orders over the phone. That would be a good example of when you're placing a transaction over the phone to remind that vendor that, hey, we participate with this program. Please use my third-party account number. So again, that's just a handful of best practices that we've put into the marketplace that we know drive greater value for our clients in this space. So with that said, it's easy for me to sit up here and speak as far as defining what a freight management program is, but as you heard on the front end, we wanted to invite a client of ours that has actually experienced a freight management program and ask him a couple questions and get to understand his experience and his journey through this process. So I did want to, again, thank Greg for joining us here. Greg, can you hear me okay out there?
Yes, can you hear me?
I can. Perfect.
Great.
So thanks for joining us. I know we have a couple of questions we want to ask you, but let's start with telling us a little bit about your facility.
Sure, and sorry for the repeat if were on the call to start, but I am the administrator of a multi-specialty ASC located just outside of Boston. We do a little bit of general surgery, but mainly orthopedics and pain management. We have 3 ORs in a procedure room. We do about 500 cases a month or so. We're a fairly busy center. We do have a management company, AmSurge, and so some on the calls work with AmSurge. We work with them as well. And as the administrator, I oversee my materials manager and clinical folks, much like probably many of those on the call here.
Great. Thanks for the background, Greg. So let's start with understanding what made you decide to sign for a freight management program in the first place. I know you've been utilizing the program for a handful of years now. What was the impetus of beginning this program?
Sure. Again, much like maybe those on the call, our management company kind of recommended that we look at this, and our rep, who we have a great relationship with, kind of bought it to us. And to be honest with you, there was nothing that I never really would have thought that shipping itself was a savings opportunity for us. And so, we looked at it and went through the whole process, much less in depth than you did here, which I thought was pretty fascinating. And so, they kind of showed us what benefits we could have and that the process was seamless, et cetera. And so we went for it. And again, I'll talk a little bit about the benefits we've had so far.
So what were the problems you were facing before utilizing a program? I know you mentioned how this was, or you explained how this was brought to your attention, but did you have any problems before using a freight management program?
Yeah, I mean, as I went back and looked at, shipping charges, I saw they were on the high side. And, we probably operate like most like the folks on the call. We have kind of our consistent volume, but then we have, add-on cases and specialty items that are kind of shipped in. And it's those that are the most frustrating for, again, somebody in my shoes. I think, you have a $100 implant or a $100 device or whatever you're shipping in, you're going to pay, and you pay $50 to have it overnighted. So when you actually look at it, that's the most kind of frustrating portion of it, was the high shipping charge side of it, and so to have an opportunity to lower that, again, seemed like kind of like a no-brainer.
Yeah, we get that a lot. And that's a great example. I know we use kind of just a generic example in this presentation today, but you're bringing it into reality as far as those expedited overnight shipments, how much they cost if the vendor's controlling the freight versus how much they cost when you're controlling the freight. So that's great. Yeah, so that's basically how you came to utilize a program. That's a little bit about your problems before using a freight management program. So what's your overall experience with the freight management company you're using today?
So our experience has been very, very good with OptiFreight. We really have had no issues or problems, even the startup. As we go back and we look at it, particularly my materials manager, we've saved thousands of dollars just as kind of promised. And with there being no cost to the program, it's been a big win for us. We had no issues.
That's great. So what part of the services are you using today? Just curious. I know we talked about several different components, and as we kind of went over today, there's the initial immediate benefit of just basically signing up, and then there's several different ways you can maximize the value. What types of services are you using today?
Yeah, so we've used it for a while, but I don't think we're fully maximizing the volume either. We're basically just using it for the inbound shipments now, and for those who work with in the orthopedics world, vendors like ComMed, Arthrex, Stryker, Smith & Nephew. Even the other day we had a smaller vendor that we kind of threw out there, and they actually work with them as well. So we're just using it for the inbound side of things, but we are looking at using it for outbound and for large freight as well.
That's great. Here's another question. I know this is a pretty common, I'd say, obstacle as we talk to some surgery centers that are entertaining, utilizing this program. It's easy for us to explain, but I think it'd be even more meaningful to hear from one of their counterparts in the country. What was the implementation process like to your facility? Did it impact you? Did it impact your team? How hard was it?
And this is always kind of a struggle, I think, for administrators or materials managers, whoever's kind of starting up any new process or service or vendor, what have you, is the change, right? Nobody likes to do change, and there's always a hiccup or what have you. And I can honestly say this is very, very seamless. So much so that this wasn't really even on my radar. I mean, I usually hear back when there's issues or something like that. Basically, what happened was we signed our GPO contract. Again, our rep worked us on that. We provided a list of vendors and the account numbers, et cetera. We sent that all over to OptiFreight, and they reach out to the vendors. They handle everything. And I mentioned the other day we put a smaller vendor on there. I mean, it's very, very simple. You just pass along your account number and the vendor information, and they kind of set everything up for you. So, again, besides seeing more FedEx now instead of UPS kind of drivers, which we utilize, there's really no impact to patient care or operations or anything like that. We've had no disruptions. It's very, very simple, and that's kind of the a great selling point, because you think that's all well and good, but it's going to be a big problem for us, or a big change. But it was really seamless.
So here's the big question I'm sure everyone out there is curious about, because we used generic numbers today. How much or what kind of savings are you seeing at your facility? If you could share a little bit about that.
Sure. Over the last 12 months, we look back and we saved more than $17,000, which, if you look kind of at the metrics in comparison overall, it's about a 52% savings. So I saw I don't remember what they kind of quote unquote promised us or said where the range would be at, and you said 30 to 50% or something like that. But we're over that. And again, we have a lot of kind of just in time ordering and stuff that comes in kind of last minute, and again we do a lot of work with these vendors I mentioned before, and so $17,000 for just signing up with the program that has no cost. I mean, I think any of us will take that any single day.
Yeah. And again, it's probably much more meaningful coming from you than it is from me, so that's great to hear. So yeah, just as probably a final question, our little interview here today is just tell us about your overall satisfaction or your experience with the program. Have you been overall pleased?
Yeah, I mean, obviously that's why I'm on the call. I guess I'd let those know that are on here. I'm not getting paid by Cardinal or anything like that. I mean, basically our rep came to us and showed us the savings, and he kind of asked if I would be willing to talk about this and take the time out of my day. And obviously I believe in it enough to kind of take the time to get in the call and talk to you about it. I think as administrators, we look at every single line item, and we're kind of constantly looking at things, but I think we're always hyper-focused on the medical supplies and the implants and the office supplies. And shipping was something I think we never thought we could actually control, right? But, and again, this is really a no-brainer. I mean, and now looking at the slides, you wonder how a company could actually, profit on shipping. And so just by kind of, pulling the trigger and signing up with OptiFreight and getting this thing going, you can get savings that you never really thought you could have. So for me, again, that's why I took the time to jump on the call here and tell you guys that, it's, I'm very, very thankful that it was introduced to us and that we signed on, and that we're experiencing all these savings overall.
That's great, Greg. And it kind of ties us back to the beginning about the hidden freight chart, or the hidden savings that you may not be looking at. And yeah, I kind of touched on it. I think that's an important point there, Greg, is that, we understand that people in your position and those listening on the call today go to extreme measures to control their costs, but they typically focus because they have limited resources. You have limited resources at your facility. They're going to focus on the product cost because it's arguably driving a greater cost in your supply chain. So you spend your time negotiating those contracts and finding access to contracts that help reduce that cost. And ultimately, that's where we saw this gap in the market, again, 15 years ago, was that it's easy to overlook the freight component. And the story that we put together was that, well, the program itself, that we can implement on at your facility can help address that freight cost without any impact to you. So I think that's a great way to come full circle with our discussion today.
Great.
So what we're going to do here is open it up to Q&A. I have a couple questions that have come in. So, Greg, I'm happy to have you on the line as I go through some of these questions. I'll let you know if, and defer to you if there's some that makes sense for you to chime in on, and please add any color as they come in as well. Okay, first question. This is pretty common. Do I have to be a Cardinal Health customer to utilize OptiFreight? We get that a lot. The answer is simple, no. Remember, again, we are addressing the direct freight cost here, not the distribution cost. In fact, about 50% or half of our current clients that are using OptiFreight today are not a Cardinal Health distribution client. So hopefully that gives you some perspective that you don't necessarily have to use Cardinal as a distributor to ultimately utilize OptiFreight. Here's a related question is, do most distributors have a freight management program? To my knowledge, when I've seen the industry, no. There's not a lot of distributors. So your McKessons, your Medlines, your Owens and Minors of the world, they have not built out or have a freight management program of their own. Again, at least to my insight into the marketplace. Because we're talking about the distributors, let's add this question here. How does your program impact your distribution contract? Kind of back to how we started the conversation about the distributors, it does not impact your distribution contract at all. Again, just remember, we're addressing that direct freight spend, that 60% of your product that's coming direct from the vendor or manufacturer. We are not touching or impacting your distribution contract in the least. This question coming in from Douglas, how do you handle vendors that won't use third-party shipping? That's a great question. We didn't get too much into what we refer to as non-compliant or non-participating vendors. We basically focus most of this discussion on the lowest hanging fruit, or those vendors that will ultimately use a program. But there are vendors out there that will not ship in a third-party freight management program. The reason is probably pretty obvious. They refuse to comply because they're holding out, or they want to maintain or ultimately hold on to that profit center that we talked about before. There's several different ways that we approach those non-participating or non-compliant vendors. Of course, and most effective is leveraging our clients, leveraging you, leveraging our 21,000 facilities across the country to basically tip the scales to say, you may not want to, or historically you may not have participated in this type of program, but there's enough volume and enough pressure from our clients to ultimately force them to use a program. We also leverage our relationships. I mentioned on the top end, and Greg mentioned here with AmSurge, we leverage our relationships with the aggregation groups or with the GPOs or the national and regional groups, wherever we can penetrate when those vendors sit at a table to negotiate their agreements with those GPOs or those regional groups. We are alongside of them to hopefully ensure that they require that the vendor utilizes or will utilize a third-party freight management program. Here's a question. What do you do about vendors that assess free freight? I'm gonna try to bite my tongue here a little bit. There's no such thing as free freight. There's always a cost to moving a package from point A to point B. But I understand what that question means, is that basically in a contract, the vendor has absorbed the freight cost, so they're not assessing you the freight. Again, I'd start by saying they're probably making up for that cost somewhere else, so it's probably in the product or your contract in that regard. But because we don't want to cost our clients additional money, we can elect to not have that vendor participate in our program. So you can ultimately choose which vendors do and which vendors do not participate in the program, thus making sure you maximize the overall value there. Can you provide an estimate on how much money my surgery center will save on freight? Again, a very common question. In the presentation today, we kind of broke it down to a box, right? We said about $17 in savings per box or per shipment to your facility. The ultimate question is how many boxes or how many shipments are coming into your facility. We've used some industry standards here today. Again, going back to between $8,000 to $10,000 in savings for an average surgery center. I've seen some surgery centers that do less activity because they have less procedures at their facility. And I've seen surgery centers at a far greater cost than, upwards of the hundreds of thousands of dollars in freight costs. So the best way to answer this question is that a freight management program can save you an average of 30 to 50% of what you are spending in freight. So we can use the industry standard and answer the question of say between $8,000 to $10,000. But if you're spending a couple $100,000 in freight costs, you're going to save 30 to 50% of that freight charge. Here's a question that we get often too, across different channels. Why do I need a freight management provider? Can I do this myself? One of the biggest values that a freight management provider, again, I'm going to speak on behalf of OptiFreight because that's the system and the process I know, but that scale and process is what makes this program so effective. Greg used the term, this is a no-brainer. There's no impact to his facility. It was flip a switch and receive immediate savings. In essence, anybody can do anything out there, including start your own freight management program or manage your inbound freight. But the question is there enough value for you to deploy your own resources and try to figure out how to manage your freight costs with your vendors relative to hiring a freight management program that has the expertise, the scale, and the size to drive the most effective and the greatest amount of savings overall. Just looking through some questions. Are savings to surgery centers, hospitals different based on region or carrier used? If so, what are the percentage differences? Good question. And so let's go back to the carrier discussion that we started here today. I mentioned the commercial carriers, UPS, FedEx. I can tell you and speak on behalf of OptiFreight, we leverage our relationship with FedEx. FedEx is a national carrier. It delivers to every single region in this country. There is no regional difference in regards to cost of when FedEx delivers without getting into too many nuances or details of that. So basically your cost with FedEx and your delivery cost of freight is driven by those three components I mentioned before. It's how much the package weighs, how far the package is going, and how fast the package is moving. It doesn't matter if you are in downtown Chicago or if you're in Jackson, Mississippi. Those three components are driving your freight cost, not necessarily which region you reside in. Hopefully that helps answer that question out there. This and Greg touched on this. I understand the benefits to an individual center. Are there any additional benefits to a management group or a center with several locations? The simplest answer to that is yes. Aggregation does matter. The more volume that you can leverage on your behalf. So if you take part in these groups, AmSurge is the one that Greg mentioned here today. There is ability to basically leverage that overall volume to drive better cost in the freight management program. So it's not a very complicated concept. The more volume or the more utilization of the program that our partners out there, our clients out there are using, the better cost we can provide them. So depending on which groups you participate in, which national GPOs, which surgery center groups out there that you are affiliated with or owned by, there is value in size. Size does matter when driving your overall cost with the freight management provider. Here's a question. When submitting a PO, this is a very specific question, but I wanted to address it. When submitting a PO with that language that you suggested, what should you use? Do you just include the account number? That's a good question. And again, this goes back to the years of experience OptiFreight has had in this space and working with these vendors. I know, again, speaking on behalf of OptiFreight, there's some canned language that, very simple, depending on what type of ERP system you're using. There's limitation in number of characters. So we've had to ultimately find a way to include these route guides or these freight route instructions that I mentioned in, say, 140 characters or less. So if you are interested in using PO comments, there are templates out there. I think the question was, can we just use our account number? I would recommend using, or at least noting the fact that this is a third-party account number, just so they're aware of it. But first and foremost, I'd recommend reaching out to your rep to provide some sample language so you can use what we've realized has been most effective over the last 5 to 10 years. I'm just looking. There's several questions that were I've answered. Came in a little differently, but I've already answered, so I don't want to be too redundant here. What is, and this is probably a good way to start wrapping up our discussion here today, what is the cost? What is the cost of using OptiFreight? What is the cost of using a freight management provider? Again, you know, if there's a list of 5 or 6 questions we always get, this is always one of them. There is no cost. So there is no, and Greg mentioned it from his perspective, you're not paying to use an OptiFreight program. The value you receive is ultimately by the freight management provider routing the freight through the program. There's no additional fee. There's no monthly maintenance fees. There's no contract signing fee, nothing like that. The cost is all, there is no cost to your facility. It's a free program to utilize based on, and it's ultimately driven by the volume in which you utilize the program. How do you invoice? That's probably a very good question. It can get very detailed here, so I'll keep it kind of high level. And I think the intent of this question is, what does an invoice look like? How do we track savings? How do you measure savings? So I'll do my best to try to answer that here. The invoice, at least in our case, the OptiFreight, it's a weekly invoice. It's itemized by line, so you're going to see a freight transaction per line. And it's the aggregation of all those freight transactions from the prior week. So if you had 5, 10, 1,000, 10,000 shipments that came through OptiFreight, your invoice is going to be 5, 10, 10,000 individual transactions on the freight invoice that comes from OptiFreight. That invoice includes who the vendor is, so the delivery location. So if you have multiple delivery locations within your facility, you can ultimately there'll be an audit against to ensure that there's that shipment was, or that transaction is tied back to an actual shipment. You'll also see the cost of the transaction, and depending on how you set the program up, there's additional components in the invoice that you can ultimately see. I think the questions have slowed down. I don't see any new questions coming up. Let me just take a look here. Guys, I think we have wrapped up here. I appreciate everyone's participation. Those are some great questions. I would encourage you, for those that are currently using a freight management program, if I've touched on anything in today's presentation and you want to learn more about it, such as those best practices, please don't hesitate to reach out to your rep. For those that are interested in using a freight management program, our contact information will be available as well. We're here to answer any questions. And I'd also very much like to thank the Beckers organization as well as Greg for joining us today. So again, thank you for everyone's time. And like I mentioned, everyone can hopefully get back to work and maybe even watch the Masters. Thank you, everyone.